All right, let's talk about some structures that you can find in a typical vertebrae. So here I've got a typical vertebrae. This is a thoracic vertebrae, and it kind of looks, if you look at it from the back, it looks like a giraffe head, maybe a giraffe face a little bit. But this is thoracic, and just to orient you, this is going to be anterior. This is the vertebral body, and this is going to be the anterior structure. This is the spinous process, and this is going to be a posterior structure. So this sticks out towards the back. In fact, if you feel kind of up your spine, you're going to feel these spinous processes sticking out in the back, and that's what you're feeling there. So this is thoracic vertebrae. I've got another one here. This guy is a lumbar vertebrae. Look at the difference between the two. If we look at the size of the vertebral body, right? This guy's huge, and that's because it has adapted to all the weight that it has to carry, and it's created these really huge, thick vertebral bodies. This is lumbar. It looks a little bit more like a moose head. You can kind of see it looks like a moose. That's kind of the hallmark of a typical lumbar vertebrae. So there that is. Now, the type of bone that these guys are, see, you've got all these crazy bony prominences. These are irregular bones. Okay, and we know that these bony prominences don't just happen by chance. They happen because muscles attach there and they pull on bone, and that creates a bony prominence that's going to stick out like that. Okay, so there's some landmarks that you need to know about. The vertebral body, like we talked about, is going to be the anterior structure. If you look at the vertebrae, you kind of see this ring here. This is going to be the vertebral arch. So vertebrae are pretty much consisting of the vertebral body and then this vertebral arch. Now within the vertebral arch, we have a couple structures. We have our pedicles, which are going to be this ring here between vertebral body and transverse process. This is going to be pedicle and pedicle. And then if you look towards the posterior aspect, this area here is going to be the lamina, and lamina on this side too. Okay, so those are structures within the vertebral arch. We do have some processes, and we can name those. So these are transverse processes. So these two processes on either side are transverse processes. So we're going to have a left and a right. And then towards the posterior aspect, we've got the spinous process. That's going to extend posteriorly. Now, you can also see these processes that are sticking up, and then these towards the back. These are nice and smooth, and they actually form joints. So this is going to be the superior articular processes. You've got two of them, and they're going to articulate or form a joint with the vertebrae on top of this one. So the vertebrae kind of stack up, and these articular processes create joints all along the spine. So here's two superior articular processes. Here are two inferior articular processes. So you know your terminology. Superior means on the top, inferior means on the bottom. There's also a couple holes or openings in the vertebrae. We have an opening here, and this is our vertebral foramen. So this gives space for our spinal cord to travel all the way down our vertebral column. And then if we look to the side, you see this little opening here. Well, the spinal cord is going to send off these spinal nerves in between each vertebrae. And this is the intervertebral foramen. Intervertebral means between the vertebrae. So each vertebrae is going to have this little space in between it and the one below it to allow space for those spinal nerves to pass through without getting pinched. Now, if you've ever known anyone who's had a pinched nerve in their back or their neck, this is a likely culprit because our body tends to lay down bone in this area, and it can pinch on those nerves, and that can cause pain coming from the nerves that are trying to go through that little space.